Dear friends, in this video we will discuss about factors affecting growth and development. There are maternal factors, fetal factors and postnatal factors. The maternal factors are maternal age. The birth weight increases as the maternal age increases. Parity. As the parity increases, the birth weight increases. That is, the first baby is likely to be smaller than the second one. Maternal height and weight. Stature and weight of offspring resembles the parents. Maternal physical activity. Strenuous activity in the last trimester tends to compromise uteroplacental circulation. Resultant hypoxia may lead to lower birth weight. Malnutrition. Maternal malnutrition causes low birth weight. Next, maternal substance abuse. Tobacco and alcohol consumption may result in small for date babies. Maternal illness related to pregnancy. Pregnancy-induced hypertension, eclampsia, other chronic medical conditions such as chronic renal or lung disease can result in small for date babies. The maternal infections are, that is, cheap torch, chickenpox, hepatitis, enterovirus, AIDS, parvovirus, toxoplasmosis, rubella, cytomegalovirus, herpes and syphilis. Maternal infections have adverse effect on the fetus. Maternal drugs. Thalidomide causes teratogenic effect on the fetal growth. Maternal endocrine diseases. Diabetes mellitus, hypothyroidism, etc. may produce big babies. The fetal factors are sex of fetus. Male babies are slightly larger. This may be related to various androgenic hormones. Next, chromosomal disorders like Down syndrome and Turner syndrome. Hormones. The hormones that affect the intrauterine growth can be remembered as INPTA, insulin, peptide growth factors, thyroxine and androgens. Genetic potential. Parental traits are usually transmitted to the offspring. Thus, tall parents have tall children. Next, postnatal factors. Nutrition. A balanced diet with adequate carbohydrate, proteins, fats, micronutrients are essential for the proper growth. Socioeconomic status. Babies born in well-to-do families grow well due to better nutrition, sanitation and hygiene. Hormones. Growth during childhood is growth hormone dependent and growth during adolescence is sex hormone dependent. Emotional. A happy environment with lots of parental love and care results in better overall growth and dependent. Cultural. Bad child rearing practices, religious taboos against consumption of certain foods, etc. will affect the proper nutrition and thereby the growth of the child. Trauma. Fracture of bones involving the epiphysis affects the skeletal growth. A serious head injury can affect mental development in a child. The stages of growth and development are: prenatal includes embryonic stage from conception to 8 weeks. Fetal stage from 8 weeks to 40 weeks or 42 weeks. Neonate from birth to end of 1 month. Infancy from 1 month to end of 1 year. Early childhood includes toddler from 1 year to 3 years. Preschooler from 3 to 6 years. Middle childhood, that is school age, from 6 to 12 years. Late childhood, adolescent, from 13 years to approximately 18 years. There are types of growth and development. The types of growth are physical growth and physiological growth. The physical growth includes height, weight, head circumference, chest circumference, and mid-arm circumference. Physiological growth includes vital signs. The types of development are motor development, cognitive development, emotional development, social development, and spiritual development. Methods of assessment of growth. Anthropometry assesses the overall growth. First, weight. The weight of the child is recorded on a beam balance or electronic balance. The weighing scale should be corrected for any zero error before measurement. Serial measurement should be done on the same weighing scale. The normal weight of a child is 2.5 kg to 4 kg at birth. The birth weight doubles by 5 months, triples by 1 year, and quadruples by 2 years. Which formula for calculating the weight? 3 to 12 months, age in months plus 9 by 2, 1 to 6 years, age in years into 2 plus 8, 7 to 12 years, age in years into 7 minus 5 by 2, more than 12 years, age in years into 3 plus 2. Height. The term length is used when the recumbent length is taken in a small child who cannot stand. Length is measured by infantometer. Height is taken with the child standing against a firm calibrated wall with the heels, buttocks, shoulders and the occiput touching the wall and the head parallel to the ground. At birth, the height is 50 centimeter, 6 months 65 centimeter and 1 year 75 centimeter. Above 1 year of age, the formula for calculating the height is age in years into 6 plus 77. Next, head circumference. The head circumference is measured using non-stretchable tape placed over the occipital protuberance at the back and just above the supraorbital ridges in the front. At birth, the head circumference is 33 to 35 centimeter, at 6 months 43 centimeter, at 1 year 46 centimeter. The skull has two fontanelles, anterior fontanelle and posterior fontanelle. This image shows the anterior fontanelle and posterior fontanelle. Anterior fontanelle is in diamond shape. It is the junction of sagittal and coronal and frontal sutures between two frontal and two parietal bones, 3 to 4 centimeter in length and 2 to 3 centimeter width. It closes by 12 to 18 months. Posterior fontanelle is triangular in shape. It is located between occipital and two parietal bones. It closes by 6 to 8 weeks. Chest circumference. The chest circumference is measured at the level of nipples, midway between inspiration and expiration. At birth, 30.5 centimeter to 33 centimeter, usually 2 to 3 centimeter less than head circumference. At 9 months to 1 year, head circumference is equal to chest circumference. Above 1 year, the chest circumference is greater than the head circumference. Next, mid-arm circumference. Mid-arm circumference is measured at a point midway between the tip of acromion process of scapula and the olecranon process. Normal 13.5 to 16 centimeter in 1 to 6 years. More than 13 centimeter is normal. 12.5 to 13.5 centimeter moderate malnutrition, less than 12.5 centimeter severe malnutrition. The physiological growth shows respiration, normal variations are 30 to 60 respirations per minute, that average is 40 respirations per minute. Heart rate apical is normal variations are 100 to 160 beats per minute, 100 while sleeping, 160 while crying. Temperature rectal 35.6 degrees Celsius to 37.5 degrees Celsius. Axillary 36.5 degrees Celsius to 37 degrees Celsius. Blood pressure at birth is average 75 to 42, that is 60 to 80 mm of Hg systolic and 40 to 50 mm of Hg diastolic. Thank you.